Yes, I apologize. We had some technical issues. So again, I do apologize that we had some issues um, with with Facebook Live. But again, thank you for joining me. Aloha, many of you have probably heard of CBD oil and medical marijuana. So today I'll be explaining what the differences are and their potential uses in medicine. CBD stands for cannabidiol, which is a compound in the cannabis plant. And here's something most people aren't aware of. Our brain actually makes cannabidiol and other compounds naturally, and other similar compounds naturally. These are called cannabinoids. They regulate things like mood, appetite, and pain. In other words, as with many other compounds in our body, nature thought that cannabinoids were so important that we come with them built in. So when we take CBD, oil, or marijuana, it is working through the system in our brain that naturally makes and uses these compounds. So thank you for joining me today. I'm Dr. Catherine Taketa-Wong, and I'm a naturopathic physician and ND. Like medical doctors, I attended a four-year medical school. I was trained as a primary care physician. I order lab tests, write prescriptions, and do school physicals the same as any other doctor. But with naturopathic medicine, there is much more. The typical medical school, a conventional medical school that trains medical doctors, typically offers about 19.6 hours of training in nutrition. Naturopathic doctors, on the other hand, receive 155 hours in order to also be trained in the power of nutrition to build health from the inside. Applying that knowledge to a patient's condition takes a lot more time than prescribing pills. My office visits are a full hour. In addition to that, I'm also a licensed acupuncturist trained in Chinese medicine. My goal was to educate myself as widely as possible because my passion is to help people not only get healthy, but stay healthy. I love caring for my patients and believe strongly in working with them as partners in their health and well being. There are three pillars that form the foundation of my practice. They are one, to heal, two, to educate, and three, to empower. Today's event is a perfect example of those pillars. You'll learn how CBD oil and medical marijuana have a place in the medical field and how they can safely help people with certain conditions, including seizures, cancer, anxiety, depression, insomnia, pain, and hyperactivity and other conditions in both ADHD and autism. They also may play a role in regulating the immune system as well. Just so you know, as we go along, if you have a health condition that you would like to talk with me about, please call our office and schedule a free phone consultation. There is no charge because I don't take new patients without reviewing their situation first. We discuss your health conditions and come up with a plan that would help you the most. To schedule a free consultation, just call or text our office or click on the link in the post. All the contact information is here on our Facebook page. Now, going to our topic today of CBD oil and medical marijuana. So whether CBD oil or medical marijuana, they both come from the cannabis plant. Cannabis has many different species and strains. Some are classified as marijuana and have a component called THC. THC is the element that causes intoxication and has a factor for addiction, which is a potential side effect of its use. However, for certain conditions, THC has a higher potential for therapeutic benefits, so medical marijuana may provide more effective treatment in certain conditions. The more commonly used form of cannabis in my practice is CBD oil. Again, CBD stands for cannabidiol, which typically is taken orally. CBD oils that are labeled full spectrum have a naturally occurring amount of THC, which is 0.3% or less. That conforms to the legal limit and allows CBD oils to be purchased over the counter. There are no intoxication properties with CBD oil, even at high doses, and such are used, or even at high doses, such as are used for seizures. So some people need to be sure that there is no chance of even a tiny amount of THC in their system due to work requirements. So some CBD oils remove all of the THC, and these are typically labeled and they say 0% THC. The trade-off is that the substance may be less effective if all the THC is removed, again, depending on the condition. In some cases, people really don't notice much of a difference. I've had patients ask me about the difference between marijuana and medical marijuana. Aren't they the same plant? Yes, they are. However, medical marijuana is grown to produce a particular amount of THC that can then be measured. Whether used orally or smoked, it can be dosed appropriately like any other medicine. What's important to remember while I'm discussing these medicines is that my patients and I are in a partnership for health. My protocols and guidance added to their commitment to improve their lives enables to them to be empowered with their health. That means they learn how to help improve their condition, how to heal their condition, how to feel more energetic, and how to be happier and healthier overall. As you're viewing this and want to talk with me, just call or text our office to schedule a free phone consultation with me. There is no charge because, again, I don't take patients without talking to them first. I always want to make sure that what I do fits their needs. You'll find all the contact information on our Facebook page, and you can also click on the link in the post. In my practice, as a general rule, I typically prefer to start with CBD oil. Depending on the condition, if that is not working well enough, then I may recommend medical marijuana and refer them to other physicians for that aspect of their treatment. One of the most life-changing uses of CBD oil that I've seen work with children, especially those with autism, is with seizures. It's definitely made a difference in reducing the frequency and severity of seizures. I've seen it be helpful for both children and adults with seizures. For many patients, CBD oil has allowed them to decrease the doses of pharmaceutical medications, and sometimes dramatically. CBD oil has also proved effective in autism when children have aggressive or violent behavior towards themselves or others. Some children will, for example, bite their arm or bang their head on the floor or the wall or hit their head or their tummy with their fist. The CBD oil often will help to calm the child and improve their behavior. However, I do want to emphasize that I don't believe in using it as the sole solution for a child's medical problems. I am always looking for underlying causes. So even if CBD oil helps with behavior, there could be, in the instance of children with autism who are aggressive or violent towards themselves or others, there could be inflammation in their brain or acid reflux in their gut. There could also be a host of other medical conditions that could be going on that can be the underlying cause for pain. And that is often in these cases why we see these types of behavior in children with autism. I've seen many children where they've gone to the pediatrician or even a developmental pediatrician who's told them, oh, it's just because your child has autism. And we know from medical research that that is not the case, that many of these children have underlying medical conditions, especially gut inflammation. And when we treat that, we often see these children improving. CBD oil is not a substitute for laboratory testing and my specialized medical treatment. Another use for CBD oil is with oppositional and defiant disorder or oppositional and defiant behavior. I know sometimes children and especially teens can be a handful by nature. This can be a part of the maturation process. But there is a major difference between kids being kids and a diagnosis of oppositional defiant disorder. In these situations, they are often very extreme. These children are excessively volatile, violent, aggressive, and hostile to anyone in authority. If you tell them not to do something, then they must do it. It's almost really like a reactive impulse that they can't consciously control. Conversely, if you tell them to do something, then they have to not do it, even if they do not want to do it. So, what's going on often with these children is that there is an imbalance in their neurotransmitters or brain chemicals. And sometimes it can stem from issues with gut bacteria, even in children with autism. I do the same kind of workup either way. It essentially stems from problems with the brain, and it is not due to poor parenting. Because the behavior is often the result of an imbalance with neurotransmitters, I've definitely seen improvement with CBD oil. It calms them so they're not as extreme and they're more in control of their reactions. CBD oil can also be helpful for anxiety, insomnia, pain in general, as well as OCD and hyperactivity in children with autism or ADHD. Early research also suggests that CBD oil may help with autoimmune conditions. The research is not conclusive, and I will have to say that I haven't seen it make a huge difference in some of my patients, but it does seem to be helpful in certain conditions and may help to regulate the immune system. I want to transition now to talking about medical marijuana. One of the conditions that typically responds better to medical marijuana is cancer treatment, particularly when it involves chemotherapy. Chemo typically will cause pain as well as nausea, vomiting, and lack of appetite. I've had patients who found that medical marijuana made a big difference while going through chemo. Their pain was more manageable, their nausea went down significantly, their food was more appealing, and so then they were better able to keep their weight up. People who also have chronic conditions involving low appetite or who struggle to gain weight may also find medical marijuana to be beneficial. I've also had cases of children with autism involving extreme violence who had to be given oral medical marijuana because nothing else was working to calm their brains in the short term. These are children who are a significant safety threat to their parents, themselves, and others. The family can sometimes be fearful of their child's, fearful for their child's life and their own life because the child is not sleeping. They may be beating up family members, injuring themselves, destroying the house. I've had a lot of parents say that their child was screaming like a howling banshee in the middle of the night. And they were really afraid that their child, the neighbors were going to call CPS on them because it really sounded like the child was being beat up, and oftentimes they just may be in severe pain or they're screaming and having a lot of these issues. Um, I do want to emphasize that these are cases where the family has really tried everything else. The child in that case may not tolerate antipsychotic medications. High doses of CBD oil may not be enough, and it's a risk benefit decision medically. So, yes, there are certainly risks with some children or teens taking medical marijuana, but if that's what's going to bring safety to the family, then it may be worth it. Also, there may be some cases of anxiety where if CBD oil is not effective, medical marijuana may help. I trust our discussion about CBD oil and medical marijuana has been useful for you. You're welcome to talk with me personally about any health concerns you may have so that you can feel empowered about your health. Just call or text our office to schedule a free phone consultation with me. There is no charge because, again, I don't take patients without talking to them first. I always want to make sure that what I do fits their needs. You'll find all the contact information on our Facebook page, and you can also click on the link in the post. Mahalo, and I look forward to being with you in 2 weeks. Aloha.